Hi everyone, welcome to Evaluation Part B, Planning Your Evaluation. In this little recording, I'm going to talk a little bit about the difference between evaluation and research. We'll talk a little bit about different types of evaluation methods, and these are some methods that you can be thinking about incorporating into your evaluation plans for Assessment 3. I'll talk about indicators, a little bit about managing your evaluation, and then finally disseminating your findings. Last week, Glenda would have talked about what evaluation is and why we do it and the importance of it. Hopefully she's talked a little bit about formulating evaluation questions, a little bit about design, and hopefully you'll be able to recall the different types of evaluation in terms of impact, process and outcome. So obviously when we're talking about outcome evaluation, we're talking about measuring our goal. When we talk about impact evaluation, we're talking about how we measure our objectives, and then the process evaluation is the measurement of our strategies. So just to quickly recap what evaluation is, really, we use evaluation to make judgments about the value of our health promotion work. We assess things like the appropriateness of it, the effectiveness of the work that we've been doing, how efficient we have been, and also we measure equity, can measure equity as well. There are some slight differences between evaluation and research. Some people often think that evaluation is research, and it certainly uses research skills, or the same sorts of skills that we would be using in research. However, there are some differences between research and evaluation. When we're talking about research, what we're aiming to do is to seek or to generate new knowledge. Whereas with evaluation, what we're looking for is information really for decision making. In research, the work that we do is researcher focused. It's about generating hypotheses and testing hypotheses. Whereas in evaluation, the emphasis or the focus is really on stakeholders. And it's about answering some key questions that we might have about the work that we've been doing. In research, we, after we've, conducted our research, we tend to make research recommendations, whereas with evaluation, we're making recommendations based on those key questions. And in terms of, I guess, what we do once we've got the results is in research, we tend to publish those typically in the peer-reviewed literature, whereas with evaluation, we tend to disseminate and report back to our key stakeholders. So I just wanted you to be aware of the differences. And so while we might be using the same sorts of skills in terms of data collection and data analysis, the purpose for doing research and evaluation is actually quite different. So I want to talk a little bit about some evaluation methods, as you will need to be thinking about, the methods that you're, going to write into your evaluation plans for Assessment 3. When we're talking about evaluation or planning for an evaluation, there's a number of steps that we go through. And so I'm going to go through each of these with you and talk about some of the methods that we use. In step 1, we're talking about determining the purpose of our evaluation. There's a couple of things that we need to know prior to planning our evaluation. And so the first thing we need to know is, what is the purpose of our evaluation? What are we trying to evaluate and why? We need to understand who the evaluation is for. Is it for us as program planners and health promotion workers? Is it for our participants? Are we evaluating for our funding body? Are we evaluating for other key stakeholders? So we need to have a bit of an understanding about what we're trying to evaluate and who for. We then need to think about what information do they want and what difference would that information make, remembering that evaluation is around, that making decisions about programs. We also need to think about what is the format and the details required for the evaluation report. And do the key stakeholders all agree on all of these issues that we're wanting to answer in our evaluation? You also need to think about what you personally want to know from, as the health promotion worker, what do you want to know from your evaluation in terms of how the evaluation could improve your practice. So you need to understand and consider those things. And then you also need to think about what questions you would like this evaluation to answer. And so, there's a number of, different types of questions that we might want to have answered, or seek to answer through our evaluation. It might be the questions around, did the project meet its objectives? Did the project increase knowledge or awareness? Did the project change people's behaviours or intentions to change behaviour? Are all aspects of the program being implemented, and are they being implemented as we had planned and intended? Are the materials or the components of the project of good quality? Were people satisfied with, our program? And so these key questions really should be formulated in areas such as thinking about our reach, the appropriateness of what we've been doing, implementation, effectiveness, efficiency, and of course maintenance as well. In terms of how many questions you might want to have for your evaluation, that will vary. It might be that you have 2 or 3 key questions for your evaluation that you want to seek to answer, or it may be that you've got 12 or 15 questions that you need to answer. But the first part of planning your evaluation is determining that purpose and thinking about what are those key questions. What do you want to know and why? Once you've thought about that, you can then start to choose your evaluation methods. And in order to maximise the value of information collected for evaluation, you need to choose a strong study design, and you need to identify valid and reliable information sources and data collection tools, and use rigorous data collection methods as well. When we are talking about rigour in quantitative design, it's judged by how narrow, concise and objective the design and the analysis techniques are. If we're using a qualitative approach, then that rigour is about being open to the data, adhering to specific philosophical perspectives, and the thoroughness in collecting the data. And so it's really about how trustworthy is the data. So some of the things you need to be thinking about in terms of study design include things like who is your target group, and who will provide the data that'll actually be required to answer your questions. What tools are you going to need? So are you going to, use questionnaires? Perhaps interview is the most appropriate method. Maybe you'll have some sort of checklist. Are there existing tools out there that you can use, or do you need to develop new tools? And then you need to think about things like how will you actually collect that data? Who will do it? Will it be you? Will it be perhaps program participants? Maybe you're employing somebody external to do it, but you do need to think about this in the planning. What will be the time, place and methods of data recording? And are there any ethical issues that you might need to consider? So when you're starting to plan your evaluations for Assessment 3, you do need to think about your study design. So for example, are you going to be doing some pre and post measures with the same subjects? Are you going to be doing some, perhaps appropriate comparisons? Or maybe you're going to have a control group, or perhaps you're going to compare your findings and indicators with population indicators. So you do need to think about the overall study design, and then start to think about your target group and your tools and your other procedures. You then need to coordinate the evaluation plan. So having a solid plan and have these aspects well documented. So thinking about what tasks need to be done, what skills are required for the evaluation. Do you have the required skills? And if not, where will you get those from? perhaps it's you need to do some skill development first, or perhaps there are other people that you can draw upon who have those skills already. You need to think about who's going to manage the evaluation. Will it be you? Will it be somebody else in the organisation? Who's going to conduct it? Your budget. And then also what's the time frame as well. And so this is where using things like a Gantt chart, can be really useful for writing the timeframes, making sure that you've got an accurate budget and that you've thought through all of the costs is also really important. And so I think what this does is reiterates the importance of good planning, that not only do we plan our program in terms of design and implementation, but we also need to plan the actual evaluation as well. Once we've got that, we can, we've thought about those steps, we can then start to collect the data. And so again, this takes some planning because you need to think about how will the data be collected. Let's say, are you going to use interviews? Are you going to do surveys, observations? Are there, are you actually already recording data through things like participation and that just need to be analysed? So you do need to think through what are the methods that you're going to use. How will those methods work in practice? Because it's all very good well to have a plan, but how does that actually translate into practice? If you're going to do observations, how will you do that if you're part of the program and implementing the program? If you're going to do surveys, how will you do the surveys? Will they be done face-to-face? Are you going to do them through the mail, electronic? Those are the things that you need to be planning for in your evaluation plan. You also need to think about how the data will be organised, sorted and stored. So obviously there are, if you're collecting people's personal information, there are ethical implications for that. And you also need to think through things like privacy. You need to think through who's going to have access to this data, where's it going to be stored, on password protected computers and locked filing cabinets. So you do need to think through those. And then also thinking through, once you've thought through your main data collection methods, are there any other ways that you might need to collect data? Just thinking through in case there's something that you have actually missed. The fifth step is to analyse and actually interpret the data. And so you do, again, you need to plan for this. So you need to think about how is the data to be analysed and ensuring that the analysis methods are appropriate for the data that you've collected and your overall study design. And then you can start to think through, once you've analysed it, what are the findings and what do they mean? And then thinking through what are the implications of these findings and what recommendations will be made. And so this is where you can come back to your key questions around, are there recommendations to be made in terms of the process, so things like the materials or the components. Perhaps there are recommendations to be made in terms of things like the budget or the timing, or even things like, your target group. So this is where you go back to what your key questions were and think about what are the implications and recommendations based on the data that you've collected. Then you can report your findings. So you will need to think about and plan for what reports will be made, what formats will be used, and how will the findings be shared or disseminated. Remembering that, depending on who you're writing for, can determine how you write that and what format you use. So the information that you present to perhaps funding bodies will be quite different to the information and how you present that information to your participants, for example. So you might need to think about that different stakeholders will require different information and you'll present that in different formats. The last step is to reassess the program or the project. And so this is part of that ongoing cycle of program planning, implementation, evaluation, redesign. And so it's about looking at, in light of these findings and recommendations, thinking about what would be done differently in the future. So this is still an important part of that evaluation process. Just quickly, we've put together a bit of an example of an evaluation template. And so this is what you will see in the Assessment 3 planning document that we've given you. So, for example, if you're thinking about your impact evaluation, remembering that impact evaluations measure our objectives, then what you can do is, in this template, state what your objective is. So this obviously comes back from your program plan. Then you need to identify what are your indicators, and I'm going to talk about those in a moment. So basically, these are the measures that you will use to know that you've been successful in achieving this objective. And then documenting your methods and your tools. So your study design, thinking about your data collection methods, how you'll analyse your data, what specific tools that you might use to collect that data as well. And then you can see below that we can then measure our interventions or our strategies, so i.e. our process evaluation. And so here you can document what those strategies or interventions are. Again, you'll have some indicators for success, so these are the measures that you will use to know that you've been successful. And again, you can document those evaluation methods and tools. I think, again, data collection methods, the tools that you're going to use, using a particular survey, maybe it's an interview schedule, and then also documenting your analysis of that as well. The other thing that you can include in your template are also timelines and responsibilities. So you can actually even add a column and make note of who is responsible for doing what and when it will be actually completed by, and are there any other resources that you might need to factor in as well. As I say, evaluation requires good planning, and I talked about the importance of setting out your timeline. So part of your evaluation plan might be that template, but it might also include having some sort of Gantt chart or an evaluation schedule. So something that actually documents very clearly the timeframes for your evaluation. And keeping an evaluation tool list as well. So if you're using multiple data collection tools, maybe you've got a mixture of surveys, interviews, maybe you're doing some observations. And even if you're not doing multiple, maybe you're just doing surveys, but you've got different surveys for different participants, for example, or different versions of a particular tool. I would be keeping a bit of a list of all of those. And keep labeling everything really clearly. So what is the name of the tool? What information will it collect? Who are the target participants? Briefly describing, having a brief description and the study design attached to it, the time and the timeline for collection, your evaluation indicator, and then how you're going to analyse it as well. So I'd be keeping a list for each of your tools with those details, so that so that if you couldn't be there for the evaluation, somebody had to step in and take over, but there's enough information there for them to be able to pick this up and run with what you've actually planned. Okay, if I just quickly want to talk about evaluation indicators. So indicators are really, I say, the markers or the measures that we can use to check our accomplishment or our progress. And so evaluation indicators need to be specific, they need to be observable, and they need to be measurable, because they tell us whether or not we've been successful. They also show progress made towards achieving the outcomes in our program logic model. And so there's a number of, a whole range of indicators that we can use, and I'm going to show you some examples, more concrete examples in a moment. But some of the common indicators include things like participation rates, maybe around people's attitudes or particular behaviours, or even things like incidence and prevalence of particular health issues. So just like we have impact, process and outcome evaluation, we also have input, process and outcome indicators. So obviously input indicators measure the contributions that are necessary to implement our program. So these measure things like our funding, the staffing that we require, the partnerships and the infrastructure. Okay. Our process indicators measure the program's activities or the outputs. So these measure whether our program has been implemented as planned. Okay. It measures things, so for example, our indicators may be around levels of participant satisfaction. The indicator might be around the number of materials produced or the format that we've used to produce those materials. It might be the number of sessions that we've run. If we were doing, for example, a health education program. So those are the sorts of measures or indicators that would give us our measures for success in terms of the process. Our outcome indicators measure whether the program is achieving the expected changes in the short, intermediate and long term. So in the same way, it's measuring our objectives. So because outcome indicators measure the changes that occur over time, indicators should be measured at least at baseline, so that is before your program begins, and then again at the end of the program, so that pre and post measure. Long-term changes, are often much more difficult to measure. So if we're talking about measuring program goals, for example, thinking that might be about particular health issues or, states of health, or rates of particular conditions, for example, that can be really hard to attribute to a single program. However, that doesn't mean that a program shouldn't try to determine how they're contributing to the impact of interest. So, for example, it might be decreasing morbidity related to a particular health issue. So our outcome indicators, for example, might be things like, again, people's attitudes. It might be whether there have been changes in people's knowledge, whether that be in the short term or intermediate term. It might be maybe particular skills that people have developed, or certain behaviours that we're seeing, or even intentions for changing behaviours as well. So what you need to do when you're planning your evaluation for Assessment 3 is that for each impact and outcome, you actually need to identify appropriate indicators. So measures of how well you've achieved the changes that you were hoping for as a result of your project. The PCP, one of the PCPs have put together this lovely table of indicators, particularly impact indicators. And I've put this up as a PDF on LMS for you to refer back to. And so in this little table, you can see that there's an intervention impact measure, and then there's a bit of an explanation around what that actually means, and then some examples of the impact indicators and some suggested evaluation methods. So for example, if we were wanting to measure, maybe one of our evaluation questions is around, who did we reach? Then what we're talking about is, did we reach our intended target audience? Were they the ones actually participating in the interventions? Or were we, our health promotion intervention reach groups with the poorest health status? And so some of the indicators might be, for example, the number of individuals or organisations or groups or whoever that participate in the activities. It might be the percentage of participants who drop out. Maybe we're interested in understanding the retention. Maybe we want to measure, an indicator might be the percentage of people not from the target group who participate in the program, because that could actually tell us something, more than who did. And so some examples of some of the methods that we might use, we might use a written survey where we're collecting people's demographics, so things like age, sex, etc. Maybe, in our program, we're keeping a regular attendance sheet so we can see the number of people who have turned up, or we might use things like just some direct observations. So you can see that there's another example around, perhaps our intervention is around the development of personal skills, and, maybe we're looking at increasing people's knowledge. So it might be, for example, increasing health-related knowledge and awareness, including of where to go and what to do to obtain maybe particular health services. So some of the impact indicators might be, measuring improved understanding of, causes of ill health and healthy behaviours. Maybe it's around improved understanding of the support available to help maintain or improve health, or enhanced awareness of health systems, including where to go and what to do to access services. And so there's a number of ways that, we can measure those, or a number of methods that we can use. So we might do a written survey to see, and we could do that sort of pre and post. What was people's understanding about, say, particular causes of ill health, prior to participating in our program, and then remeasure that at the end. Maybe what we see is an increased attendance or participation at the service. So we could look at the data, attendance data, prior to the program, and then track that over a period of time to see whether there's an increase in attendance or participation after our program. We could look at maybe things like decreased attendance as well, that if people have got that information and increased knowledge or skills, that they no longer need to access that service. So we can just measure, whether there's been an increase or a decrease. So as I say, there's a number of, I'm not going to go through all of these, there's a number of key areas in this document and examples of indicators. So I'd encourage you to have a look at those. As that's as a PDF on LMS for you. Okay, so just want to quickly talk a little bit about some evaluation methods that you might use. So obviously, we can use quantitative measures, so things like qualitative measures, sorry. So for example, things like focus group, it can be a really good way of collecting data depending on what our evaluation questions are. We can use things like interviews. We could do open-ended survey questions with people. Maybe we ask participants to keep journals or diaries of their participation in the program. As I've mentioned previously, we can do things like observations. We can analyse documents. We can also do more creative methods and things like taking photographs and analysing photographs, or using what's called photo language, which is a way of using photos and getting people to ask certain questions and then get people to pick photos that best represent their response, and then they can explain that. So we can be really creative with evaluations. It doesn't always have to be surveys, interviews, focus groups. If we're using quantitative approaches, then of course there are things like, surveys. We can look at things like population statistics. We could do things like audits or checks. As I mentioned just before, we could look at service usage or attendance. We can look at anthropometric and biomedical measures. So looking at some of those individual measures like things like height and weight, for example. Or maybe looking at things like BMI or cholesterol, or blood glucose levels, those sorts of things. We could use maybe acute incidents, so things like ultrasounds and X-rays, for example, depending on type of program we were doing, if that was appropriate. And often what we are seeing in some social science evaluations, we're adding some of those biomedical measures to investigate genetic variations and some human biological measures, as well as impact on behaviours. So it's not that common in sort of, certainly not common in community development programs, it's not really appropriate, but maybe in other types of interventions. So for example, maybe some of your health education interventions, particularly around things like physical activity and nutrition, then you may want to look at things like those anthropometric and biomedical measures. But again, it depends on what the purpose of your research is, and what your research, your evaluation questions are. In terms of managing, evaluation, you do need to develop a system for managing your evaluation. You need to manage the data that you're collecting, and this includes details such as, the date that you've distributed things like surveys or other data collection tools, the date that you've collected it, date that things have been returned back to you. You need to keep records of things like sample size and response rates, unique ID codes if you're, using sort of surveys that are de-identified, things like storage location, the person responsible, if you're doing electronic measures such as electronic surveys, and making sure that you've recorded things like the hyperlinks. So really good data management is necessary for good evaluation. It ensures that you're being effective, and that there's some consistency. And it also means that your data can actually be accessible to others, and it can be verified as well. So you do need to think about how you're going to keep things like the raw data as well as the analysis as well. In terms of working with your evaluation results, I'm not going to go through this. You can have a look at this, but what I have done is put together some slides around some of the basics of presenting the data, particularly if you're going to be presenting things like graphs and charts. So there's some slides there with some of that information. As I say, I'm not going to go through this, and the reason I'm not going to go through this is because you're not actually going to be presenting evaluation findings in this subject, but it is something worth just being aware of in preparation for practice. So just go through those notes. Just some quick tips on planning and managing evaluation. As I say, it's important to have good management techniques. One of the things that you should be doing in practice is version control, and dating all of your evaluation tools so that you know that you're working on the most up-to-date. So just as you would in preparing for any assignment and you've got drafts, making sure things are labelled appropriately, and that they're all dated. Set up really simple data management practices. They don't need to be overly complicated, okay? But making sure that you have good data management practices. Recognising things like the impact that seasons can have on data. I know that sounds a bit odd, but for example, weather patterns can actually play a role in evaluation. So for example, the increase in energy consumption with the onset of winter, that can play a role in how people respond or participate in your evaluation. Really think carefully about your study design and have it documented. Include standard questions on all of your surveys, and in practice, lots of organisations will have determined questions that go on all evaluation like surveys. So often you don't really need to think about those. But if you did, then I'd be establishing a set of questions that you're going to ask all of your participants every time you do an evaluation. The other thing to think about is, do you really need to ask all of those questions? That if you want people to, particularly if you're doing something like a survey, for example, too many questions will put people off and they're less likely to finish answering them. So just think about, do you really need to ask all of those questions, and come back to what is your actual purpose of your evaluation, and will these questions help you to answer those key evaluation questions? And is the evaluation that you have planned achievable as well? I have put together, again, I'm not going to go through all of this, but there's just some tips for disseminating your evaluation findings. In your evaluation plans for Assessment 3, you will need to think about how you're going to disseminate your findings. So I would be thinking about who you're disseminating it to and in what format. There are some tips here around report writing, how to structure a report. It's incredible the number of students who don't know how to write reports or structure reports. So I would go back to these notes. It just gives you some tips around what needs to go into each section of evaluation reports, or any report really. This here is just as this is up on LMS as well, is a bit of an example of an actual real life evaluation plan. So, when we talk about program logic, when we talk about indicators, when we talk about, having a template and planning your evaluation, we're not saying that because, we think it's a good idea. We're talking about these things because this is what actually happens in practice. So this is an example of an evaluation plan for that was put together by Women's Health Victoria as part of their Working Together Against Violence project. And so you can see here that this evaluation plan looks at the outcome indicators and the data to be collected. And this is based on the obviously integrated health promotion, but also they've used a program logic as well. So you can see, this table is pretty much the same as what we have given you for Assessment 3. They've stated what their objective was. There's a little bit of a description around what is expected to happen in relation to achieving that objective. And you can see that they've got both a process and an impact evaluation plan here, where they've got their process indicators, they've got their impact indicators, and then they outline the data to be collected and the methods for those that they're going to use for their evaluation as well. So you can see, so this is, this here is in relation to their strategies. So you can see that one objective, and I mean, this goes on for a few pages, and you can certainly go and have a look at the actual document if you like, but you can see that they've got a process evaluation for each of their strategies in order to achieve that particular objective. So I would go back and perhaps have a look at the original document for this. This will give you a really good idea for, I guess, what Glenda and I would be looking for in your evaluation plans in terms of indicators and data collection methods. The only other thing that you would need to add would be your analysis and some detail around the study design as well. Okay, so in terms of what now, so at this point of the semester, you should hopefully be well underway for planning your health promotion programs. You may or may not be up to thinking about the evaluation, planning your evaluation, but what you should be doing is thinking about, come back and revisit what are your aims and objectives. How can you evaluate these? What are the key questions that you're wanting to answer in relation to those? Thinking about your strategies, and then thinking about, again, what is the process evaluation going to look like to measure those, and use that evaluation plan template that we've provided as say, it's based on that program logic model. And so it will give you the structure that you need to ensure that your evaluation is well thought out, well planned, and well documented as well.